Hey, Facebook friends. I was just informed about something really shocking, and I had to come on live right now and show this to you. First of all, I spent a morning with a family sharing their story about some pretty deep corruption happening in the hospital systems. I'm helping them write their story and write a book. So I have a lot that I really want to share, but I was just looking at a post where someone said, hey, try this experiment. Go to Google, type any 3-digit number, and then hit the word new cases and watch what happens. And I did it 4 or 5 times, and any random number I picked showed up a news story about that exact number of cases. And I'm going to show it to you right now. I grabbed my husband's phone because I want to show you. I showed it to him, and if you don't realize we are being played by the media, we are being played by the media. So I'm going to show this to you right now. Watch. Okay, this is my husband's phone. I'm in Google. I'm just going to make up a number, 456. New cases. Go. And if you scroll down, look here, 456 new cases. All right, now I'm just going to change the number to 888. Right here. Another 808 cases. 888. 888. Pick another random number. My birthday is May 8th, so let me do 508. New cases in the Google search.
Today's date, 714.
Oh, look. Here it is. San Diego reports 508 new cases. Imagine that. All these news headlines are exactly the number I posted. Today is July 14th, so let me do 714. Type in 714 new cases. Look at that. 714 have died from COVID. Are you guys seeing this? I want you to get your phone right now, and I want you to do this little experiment. If you're just joining me, get on your phone, go to Google, type any 3-digit number, and put new cases afterwards and watch what happens. And if you don't think we're being played by the media after you do that, I don't know what to tell you. But you guys, we have got to do something. We the people are losing our freedoms because we are being fed lies. And, you know, just the way they're reporting coronavirus, the way they're tracking cases, and now the way they're reporting it to us. If you think this is about a virus, you need to educate yourself. This is not about a virus. This is about us losing our freedoms. And this is very serious. So please share this message, tag people, do the exercise, and wake up, because you guys, in 4 months, our country has completely changed. Basically, for a cold. I'm not doubting that some people don't have very serious side effects with COVID, but a lot of people have very serious side effects with the flu or with pneumonia. You know, this is a virus, but we've had viruses for hundreds of years, and we've never shut our entire country down. The death rate is, what is it?
Less than 1/2 of 1%.
Less than 1/2 of 1%. We have seen the death rate drastically decline in this country. Cases are up because they're also adding in probable positive cases. So look up the definition of a probable positive case in your state. In Texas, they changed the definition. A probable positive is anybody who has 2 or more symptoms of COVID. So if you sneeze, which a lot of people sneeze in the sun or sneeze with allergies, or if you cough, if you get something stuck in your throat and you cough and you sneeze, you're considered a COVID case and marked. In Chicago, if you are a positive COVID case, they track everybody you've been in contact with. If you've been in contact with 13 people, that's marked as 14 positives based on the probable positives. You guys, there's so much corruption going on right now. If you're just joining this feed, I'm about to stop so you can go back and look. But go to Google, type in any 3-digit number, and type the words new cases afterwards and scroll down and look at all of the news articles. Do it as many times as you want. And I'm telling you, we need to wake up. We are being played. And I hope that you guys get this message and we can take action and stop this nonsense.
It was a sobering moment coming 6 months on from when the committee advised and I agreed that the outbreak constituted a public health emergency of international concern. At the time, 30th January, there were fewer than 100 cases and no deaths outside of China. When the committee met 3 months ago, 3 million cases of COVID-19 had been reported to WHO and more than 200,000 deaths. Since then, the number of cases has increased more than fivefold to 17.5 million, and the number of deaths has more than tripled to 680,000. In addition to the direct toll COVID-19 is having, the committee noted the health impact that disrupted services are having on a range of other diseases. That compounds what we already know about reduced immunization coverage, cancer screening and care, and mental health services. A survey of responses from 103 countries between mid-May and early July found that 67% of countries report disruption in family planning and contraception services. More than half of countries reported disruption in antenatal care services, and more than a third of countries reported disruption in childbirth services. On top of the health impact, we have seen the damage COVID-19 has caused socially, economically, and politically. The committee put forward a number of recommendations for countries to continue to implement to bring the virus under control. These range from sharing best practice to enhancing political commitment and leadership for national strategies and localized response activities driven by science, data, and experience. We know from serology studies that most people remain susceptible to this virus, even in areas that have experienced severe outbreaks. Over the past week, we have seen several countries that appeared as though they were past the worst, now contending with fresh spikes in cases. However, we have also seen how some countries, regions, or localities that had a high number of cases are now bringing the outbreak under control. It's not easy, of course. Strict measures may cause their own problems for delivery of essential health services, the economy, and societies overall. The committee acknowledged that member states have tough choices to make to turn the epidemic around. But they were also clear that when leaders step up and work intensely with their populations, this disease can be brought under control. We learn every day about this virus, and I'm pleased that the world has made progress in identifying treatments that can help people with the most serious forms of COVID-19 recover. The committee recommended that countries engage in the access to COVID-19 tools, ACT Accelerator, participate in relevant clinical trials, and prepare for safe and effective therapeutics and vaccine introduction. A number of vaccines are now in phase 3 clinical trials, and we all hope to have a number of effective vaccines that can help prevent people from infection. However, there is no silver bullet at the moment, and there might never be. For now, stopping outbreaks comes down to the basics of public health and disease control: testing, isolating, and treating patients, and tracing and quarantining their contacts. Do it all. Inform, empower, and listen to communities. Do it all. For individuals, It's about keeping physical distance, wearing a mask, cleaning hands regularly, and coughing safely away from others. Do it all. The message to people and governments is clear. Do it all. And when it's under control, keep going. Keep strengthening the health system. Keep improving surveillance, contact tracing, and ensure disrupted health services are restarted as quickly as possible. Keep safeguards and monitoring in place, because lifting restrictions too quickly can lead to a resurgence. Keep investing in the workforce and communicating and engaging communities. We have seen around the world that it's never too late to turn this pandemic around. If we act together today, we can save lives. We can save livelihoods if we do it all together. This week, we're also launching a mask challenge with partners from around the world, and we're encouraging people to send in photos of themselves wearing a mask, as well as being one of the key tools to stop the virus. The mask has come to represent solidarity. Like the Safe Hands and Healthy at Home challenges, we're going to be spreading further positive messages about how everyone has a role to play in breaking chains of transmission. If you're a health worker, a frontline worker, wherever you are, show us your solidarity in following national guidelines and safely wearing a mask, whether caring for patients or loved ones, riding on public transport to work, or picking up essential supplies. As well as hand sanitizer, I carry a mask with me all the time and use it when I am in places where there are crowds. By wearing a mask, you're sending a powerful message to those around you that we are all in this together. Wear a mask when appropriate. Keep your physical distance from others and avoid crowded places. Observe coughing etiquette. Clean your hands frequently, and you will be protecting yourself and others. Do it all. One of the areas that we have been continuing to study is the origins of the virus that causes COVID-19. The WHO advanced team that traveled to China has now concluded their mission to lay the groundwork for further joint efforts to identify the virus origins. As a result of these efforts, WHO and Chinese experts have drafted the terms of reference for the studies and program of work for an international team led by WHO. The international team will include leading scientists and researchers from China and around the world. Epidemiological studies will begin in Wuhan to identify the potential source of infection of the early cases. Evidence and hypotheses generated through this work will lay the ground for further longer-term studies. Finally, this week is Breastfeeding Awareness Week. As we have seen again and again, standard public health measures are often the most effective. This week is Breastfeeding Awareness Week, and we're reiterating the importance of breastfeeding, which has life-saving benefits for babies and families. At the time of COVID-19, especially when there is disruption of health services, WHO recommends that mothers with suspected or confirmed COVID-19 should be encouraged, the same as all other mothers, to initiate or continue to breastfeed. Mothers should be counseled that the many benefits of breastfeeding for newborn babies and children substantially outweigh the potential risks for COVID-19 infection. Mother and infant should be helped to remain together while rooming in throughout the day and night, and to practice skin-to-skin contact, including kangaroo mother care, especially immediately after birth and during establishment of breastfeeding, whether they or their infants have suspected or confirmed COVID-19. I thank you.
But I think we should obviously see the number of cases in India today against the backdrop of the country's size and its massive population of 1.3 billion people. The cornerstone of the response is still the same no matter where you are. As of yesterday, there were over 1.75 million cases and over 37,000 deaths reported. India has done well on sampling. It's tested almost 20 million tests already, and does on average 500,000 tests per day. There's been a move in the last number of days and weeks to really expand testing and to allow a greater freedom for medical practitioners to request testing. So the approach to increasing that, the creation of a COVID diagnostic training centre as well, has also helping to expand the capacity to do testing. So clearly India is determined to expand its testing regime further and further afield. I believe the Ministry of Health is also importing extra oxygen concentrators and also really trying to leverage the over 43,000 health and wellness centres across the country to ensure the continuity of essential health services. Again, a focus, I think, working with WHO and with UNICEF on issuing a frontline health workers toolkit to really improve the capacity of health workers to recognise COVID and also manage infection prevention and control in a clinical setting. India is also playing a leading role in the development of potential vaccine candidates and also producing potential anti-COVID drugs. So overall, India is making a strong contribution on the international phase. Clearly, India is facing a challenge with the disease, but it is focused in particular areas. Our concern at the moment is that the disease, in moving into more rural areas that don't necessarily have the same strength in their health system, that we would see increased spread and potentially increased mortality. The pattern of the disease moving into younger age groups is also felt in India as well. So India, again, being a large, very diverse country, the situation varies across the country. The government is ramping up its response. The frontline health services are being supported, but again, the potential for this disease to spread quickly in overcrowded urban areas and in poorly served rural areas is always there, and India will obviously have to keep up a very strong and sustained effort to both prevent the spread of the disease and to treat those who fall ill.